Are you dealing with hip stiffness or hip pain that's limiting your ability to squat, do other movements in the gym, and also limiting your ability to participate in your sport? I'm gonna go over today a couple of the isolated hip mobility drills that we'll do in a lot of cases for people that are not only dealing with hip pain and stiffness, but also for some other injuries and pathologies such as low back pain or SI joint dysfunction. So what we start on more than anything is why the hips are important. Whenever we're talking about any big movement in the gym like squatting or deadlifting, or from a sprinting standpoint, cutting, the hips are undergoing a lot of rotational stress. So with that being said, if the hips can either not move well enough or they can't stabilize well enough, well, what's gonna happen is that stress has to go somewhere else. That's either gonna go to some of the soft tissue around it, or it's gonna go to the low back. And in a lot of cases, it could even just go right to the hip joint, which is why some people start to get that kind of pinching in deep hip flexion, internal rotation position. So what we're gonna start with more than anything is a posterior hip capsule mobilization. So what I'm gonna say with all of this is, I do not want this to be replicating any, especially if you do have any pain in the front of the hip or the groin, I do not want this to be replicating any pain in that area. So first thing we're gonna do, we're gonna go ahead, we're gonna get down on the floor here, hands are underneath our shoulders in a relatively upright position. The leg that we're working, we're gonna take that leg, we're gonna spin it in like so, okay? My back leg is straight, and all I wanna focus on is, I'm just more than anything, I'm shifting towards the side I'm trying to stretch. So again, I'm not doing a pigeon, it's just a very small shift more than anything coming out of that. So this is what it looks like from the side here. Spin that leg in, shifting just a little bit, and then coming back out. If you're doing this correctly, you should feel this all right in that kind of back of the hip glute area. You should not be getting anything through the back, the kind of upper pelvis SI joint area, and you certainly should not be getting anything in the groin. So from a sets and reps from a prescription standpoint, I usually like to go 1 to 2 sets of 10 reps, and I'll hold that position for about 5 seconds. So again, I'll be here, spin the leg in, I'll kind of hang out here, 1, 2, 3, 4, 5, and then I'm gonna come out of that. The next thing we're gonna do is a banded hip extension mobilization. So for those that have hip pain, especially pain on the front of their hip, whatever they do, some type of extension movement like a bridge or whatnot, and a lack of pelvic control, what we're gonna wanna work on is restoring that hip extension range of motion. So a lot of times people will just kind of be in this position, they'll just kind of jam, they'll stretch their hip flexors aggressively like that. But all they're doing more than anything is they're just pushing the front of that hip into the socket even more and probably reproducing some of that pinching sensation. So what we're gonna do is, we're just gonna go ahead, we're gonna take a heavy band here, we're gonna step into this band, and we're gonna bring that band up as high in our groin as possible, okay? So a leg that has the band around the groin, that's the down leg. So we're gonna be down in this position here. If you have a beam here to hold on to, that's totally fine. You can hold on to that. You don't necessarily need to. So before we do anything, I wanna focus on keeping my core engaged, so I'm not fully rounded forward, but I have some engagement here. And all I'm gonna do, you might even already feel a little bit on the front of the quad here. All I'm gonna do is I'm gonna very lightly squeeze my glute, hold for 5, and then relax. And that is the mobilization. What I don't want this to be is you're not just trying to let this band thrust you forward like that. You wanna keep yourself in a relatively upright position, core is engaged, you're squeezing that glute, and you should get that, not in the groin or deep in the front, the front of the hip pinching. You should get just a very kind of deep stretch and mobilization along the front of that thigh throughout the quad and hip flexor. So again, same thing, we'll go 1 to 2 sets of 10 reps, hold each one for about 5 seconds, and then we'll relax. The next thing we're gonna do, I'm gonna show you on the other leg, is we've now done a posterior mobilization, we've done an anterior mobilization, we're gonna wanna do an inferior mobilization. So to get this hip to kind of sit down and roll down a little bit more, which is what we need for getting into the bottom of the squat position. So what that's gonna look like, again, we're gonna step in the band here. Band is gonna, again, go high up around the groin. We're gonna come down to a tabletop position here. You kind of have to scoot out until you feel some good resistance. And then all you're gonna do, you're just nice and easy, scooting back a little bit, hang out there for 5, and then come back up. Hang out for 5, and then come back up, okay? So that's the inferior mobilization, same prescription we've done before. The last one we're gonna do is a lateral mobilization. So now, from this position, you literally just kind of spin in. So now the band is pulling me out laterally that way. So, same thing. What we're gonna do now, though, is we're just gonna sit back onto our heel, hold for 5, and then relax. Sit back, hold for 5, and then relax. A progression to this is you can do it with a little bit of some internal rotation bias for that position to get a little bit, just to try to get it to be a little less tolerable. I don't want you going through pain though. So what that means is, for the leg that I'm mobilizing, I'm just very gently kind of spinning my leg out here. I'm sitting down just a little bit and back up. You're gonna find you can't go as far, which is okay. You're gonna sit down, hang out there for a few, and come out of it. So those are 4 of the go-to drills that I will do for just really improving some kind of hip capsule, hip joint mobility in people that are not only dealing with hip pain, hip stiffness, but also from a low back and SI joint issues. So when can you go ahead and implement this? It really depends on where you're at. If you're in a very active flare-up from a hip injury standpoint, this is gonna be stuff you're probably doing relatively early on to kind of just start to restore some range of motion and get your pain down. Once you get back to the point where you're training more consistently, what you're gonna wanna do then is this becomes really your maintenance routine. And I honestly like doing all my maintenance work as part of my warm-up more than anything. I just like to get it out of the way and get it done. So really in this case, you throw this into your warm-up. You might have to do 2 sets, but you could do 1 set in your warm-up. If you feel like you need more after your workout is done, you do another set of each of these at the end there or from a mobility session later at night. But that's really what we're looking at in terms of restoring some hip mobility and hip range of motion in a lot of these cases we've talked about. If you have any questions on these issues that you're dealing with, drop them below in the comment section and go ahead and subscribe to our channel and like to make sure you're following for more daily tips we have not only from a rehab standpoint, but a performance and training standpoint as well.